Deciding whether and how to pursue genetic testing for hereditary cancers can be difficult. It's important to understand what this kind of genetic test can and cannot tell you about your risk of developing cancer in the future. The vast majority of cancers are not inherited, but a small subset of cancers are considered hereditary, and we can look at some of the changes that occur in specific genes that increase your risk.
It's important to know that a genetic change related to hereditary cancer does not mean that you have cancer or that you will definitely get cancer. It means simply that your risk is increased. The Kylos test takes a close look at a set of genes associated with hereditary cancer risk and determines whether those genes are changed in such a way that increases your risk of getting cancer.
Most people who order the Kylos test will receive a negative result because hereditary cancer risk is not common. The Kylos test includes most of the known genes associated with hereditary breast and ovarian cancer risk, but there are likely other genes associated with risk that we haven't yet discovered. So a negative test doesn't necessarily lower your risk of developing cancer. If you have a strong personal or family history of cancer, your risk may still be increased. Even without a strong history of cancer, you still need to do regular screenings, such as mammogram or colonoscopy, and may still develop cancer. A positive test result indicates that you have a gene change that increases your risk for one or more cancers over a lifetime. Knowing about an increased risk for cancer can allow your healthcare providers to make changes to your screening and medical management plan to reduce the likelihood of cancer developing or catch a cancer at an early, more treatable stage.
Other considerations before undergoing hereditary cancer testing include thinking through the impact that learning your test result may have on other family members. Biological relatives share genetic information, and identifying a hereditary risk factor in one person may lead to discussions with and testing of close relatives who may also share the genetic risk factor. While there are some legal protections against discrimination in healthcare and employment, your ability to get life and long-term insurance policies may be impacted. Some people choose to make changes to those types of policies before having genetic testing.
Whether to pursue hereditary cancer testing is a personal decision. If you have additional questions about the Kylos test, potential results, and implications of learning information about your hereditary cancer risk, contact your healthcare provider or Kylos Genetics.